Here we have with Klara Havelková. She's one of the coordinators, medical coordinators at Unica clinic, an IVF clinic located in Prague. This is Esther Velilla, and I'm biologist and CEO of Reproclinic, a fertility clinic located in Barcelona. In this session, we are going to review the legislation that we have in both countries and see how we can complement each other, and how can we help patients working in Prague and working in Barcelona together. Both clinics, Reproclinic and Unica, share the same proposal value. We work in an holistic way. Apart from the medical point of view and using high level of professionals and high level of technical staff and equipment in the lab, we complement the treatments with holistic treatments, as for example, nutrition, acupuncture, reflexologist, and fertility coach, because our main goal is that the patients, when arrive to the fertility treatments, they arrive in the best way, in the best moment of their soul and mind. So soul and mind and body has to be aligned, has to be in a perfect conditions to be able to receive the embryos and have the pregnancy. So we support them in a medical way and also in all these treatments during the IVF treatment and during the pregnancy. So let's go to the topic that we want to discuss today, the IVF legislation. Hi, Klara.
Hello everyone.
As you know, in the European Union, we have one main law that covers all the countries that are in Europe, that just regulates all about tissues and cells, how we have to process the cells, how we have to tag the cells in order to have the main traceability possible. If we have to ship the biological samples, how we have to do it. But each country has its own legislation about IVF and how the assisted reproduction treatments can be done and which kind of assisted reproduction treatments as well can be done. Czech Republic and Barcelona and Spain has more or less the same kind of legislation, but there's little topics that in one country cannot be done, and another country, yes, can be done. So let's go with that point. Klara, in Czech Republic, which kind of patients can you treat and which kind of patients you are not able to treat based on the law?
So based on our legislation in the Czech Republic, we can treat patients who haven't reached their 49th birthday. So the last day of their transfer that we can treat them as patients is their birthday of the 49th year. And then we cannot treat single women. So we can only have couples, one female, one man. We cannot treat same sex couples. And also, we do not have any legislation when it comes to the amount of embryos that we can transfer. However, our clinic does have a rule that we transfer maximum of 2 embryos.
Is surrogacy or gender selection as well allowed in Czech Republic or not?
Gender selection is not allowed unless there is a medical reason why it should be selected.
Yeah, it's quite similar to Spain. I mean, in Spain, gender selection is not allowed unless, as you say, there is any genetic conditions. But in those cases specifically, we also have to ask case-by-case permission to the competent body, and makes things very complicated. So gender selection, for sure, is not one of the topics that we cover on the clinic, as well as surrogacy. Surrogacy in Spain is not allowed. I think in Czech Republic it's allowed, but there are some limitations, right?
Mm-hmm.
But in Spain, it's not allowed because it's not banned, but it's not allowed. So you cannot find surrogacy in Spain. People that need that kind of treatment, they have to travel abroad. Mm-hmm. But in contrast, we are able to treat single women or single moms by choice. We're able to treat female couples. In those cases, for example, we go for different techniques. We go for intrauterine insemination with a sperm bank, or another technique that it's called shared motherhood or ROPA, most commonly named as ROPA. That means that one of the women is the one that is giving the eggs, and the other is the one that is receiving the embryos. So in that way, both members of the couple can share the motherhood. So we can treat single women, we can treat female, and also we can treat women up to 50, 51 years old. There is no any law that says that we don't have a cut point of age for the woman to be treated, but the Spanish law says that we can treat a woman until her reproductive age will be finished. So that's very ambiguous. That means that we can prolong some treatments, as you know, for fertility with egg donation to women that are more than 33, 34, 35 years old. But in our case, in our clinic, we have this internal cutoff of 51 maximum. And in this case, we ask them a lot of medical tests in order to be sure that there is no any contraindication, because at the end, what we want is a healthy baby and a healthy mother, right? So I think that could be a good point to share, because in case that there's some patient that Unica as well and Reproclinic, we work with patients worldwide. So there are not patients that are living to Czech Republic that needs this kind of treatment. We are treating a lot of patients from foreign countries, right, Klara, as well?
Yeah. Correct, because I only take care of patients who are English speaking, and of course we have other languages such as German, French, Italian, Serbian, so Polish even. So there are many pretty much all over the world.
So that's nice. So any case that you have any patient that is living outside and they don't know about legislation, as well as in our case, if we can help these patients together, we will be able to work it together. So before you say that the maximum number of embryos per load to transfer were 3 in Czech Republic?
The maximum?
The maximum.
At our clinic is 2, but it's not given by the legislation. It's not necessarily the law, but that's what kind of the conditions that are here at the clinic.
Yeah, well, we're doing a policy of single embryo transfer, but this is very similar, because at the end, IVF techniques, the pregnancy rates, the IVF culture, the equipment, and the conditions in the last 10 years has changed dramatically. So now we don't need to transfer 3 embryos. With 1 or 2 embryos, we have the maximum pregnancy rate. So that's one thing that has been improving in that years. In terms of one of the main questions that patients has as well is what to do with the frozen embryos, how long the embryos can be kept frozen at the clinic, and how you manage that. Because as the pregnancy rates and the IVF culture is increasing a lot, now we are facing that we have most of the patients, they have 2 embryos, 1 embryo to transfer in a fresh cycle, another embryos to keep frozen for a following embryo transfer. So a lot of patients has concerns about that. Can you explain a little bit about frozen embryos?
So we do, so when we do in the treatment, the patients are in the treatment, they do have a fresh embryo transfer. And then of course, additionally, they can have with the remaining embryos frozen embryo transfers. The embryos or even sperm sample can be frozen here. The clinic here says up to 20 years. Again, it's not given by legislation. It's our rule that we have as a clinic. And within that time, of course, they can come for a frozen embryo transfer at any time. They don't have to let me in advance. They just can contact us and we can start preparing the treatment for them. Then, of course, the embryos, they can either get transferred or we can also do a transport of embryos to different countries. And or the patients can get rid of them or destroy the embryos as well if they don't wish to use them anymore.
Right. So in Spain, it's a little bit different. So in that case, for example, if you have a woman that is 48 years old that has remaining embryos in Prague, if you cannot transfer there, you can ship it outside. You can send the embryos, for example, here at Barcelona to get the transfer here. So
I've had a
patients don't have to bother about this anymore. There is a solution for that, right?
Yeah, I've had a patient who reached her 49th birthday, so we couldn't treat her anymore. But we did the transfer to Spain, and she had additional transfers there as well.
Yeah, it's good for them to know that there is a solution, right? And they can have this embryo for themselves. In Spain, for example, we have by law we have to contact the patients every single year, and they have to reassess the destiny of the embryo. They have 4 possible options. They can keep the embryos frozen for themselves for their own reproductive journey. The second option is to destroy the embryos, to terminate the conservation of the embryos. The other one is to give the embryos to the science. And the last one, to give the embryos to another couple. But each of the conditions has its own complexity. We cannot destroy the embryos unless the patients give us 2 letters from 2 independent doctors saying that this woman cannot conceive anymore. So if a patient really wants to destroy, we need those letters, because if not, we'll have to keep the embryos frozen into the tanks until we have that. For the science as well, we need an official project approved by the competent body. So that means what we have to send the patients the consent form from this specific scientific project, and they have to accept the project. And to give to another couples, for example, it's another thing, because the origin of the gametes, the male and the woman, has to fulfill the conditions of being a donor. So, for example, if a couple is 40 years old, the woman is 40 years old, and they want to donate these embryos to another couple, these embryos are not eligible to be donated, because the woman is more than 35 years old. So there are some different conditions. But with that program, with the embryos that are donated to another couples, we have what we call the embryo adoption program. The law permits to transfer these embryos and to give the chance for having a child to those embryos that the patient wants to give to another couples. And that's the embryo adoption program. Also, if the patient doesn't want to, because there are some patients that doesn't want to decide what to do with the embryos, because it's a very tough decision for them, and they don't answer the letters. After 4 consecutive years without answering the letters, the embryos are considered abandoned, and the center is the one that gives the custody of the embryos. And these embryos will enter, if they are eligible for donation, they enter into the embryo adoption program. You don't have embryo bank. You have embryo bank in Czech Republic, right? You can create embryos.
So here, if the patients want to destroy the embryos, they have to sign a form in person, or they have to sign it at home, but the signatures have to be notarized. And then we need to receive the original copy, so they have to post it. And then we just give it to the embryologist, and then that's the end of it. They get rid of the embryos. They could be donated. The law doesn't say that they couldn't be donated to other couples, but we have to have a couple that would be interested in the embryos. And I don't have experience with that, because with my patients, when it came to donated eggs, they always wanted an anonymous donor, but not a couple.
Okay. But you have the chance here in Czech Republic to do embryo donation, right? Embryo donation.
From anonymous donors, we create the embryo. Yes, that is possible.
Okay. That's probably a big difference in Spain, because here, for example, you can create embryos from egg and a sperm bank, right? So it's what you have embryo donation. In Spain, we can only do that if we have a reproductive couple that wants really this, but we cannot create embryos and then assign the embryos to different people. We have to create it case by case, depending of if we have a recipient. There are little few differences. So talking about the donation program, I think it's we share the same legislation because in Spain and Czech Republic, both of the egg donation program are anonymous. But I think also there are some small things. Can you explain us your program, your egg donation program?
So the egg donation, as you said, is completely anonymous, which means that the donor will never be able to know the names of the patients. They'll never have access to the patients, and the other way around as well. The patients will never know the name or see any pictures of the donors. So what we do is we ask the patients to send us pictures or any requirements they might have for the donor. And then because us as coordinators, we don't have access to the donor program either. So I send it over to my colleagues who look for the donors, and they try to match, of course, as much as they can when it comes to education, hobbies, eye color, hair color, height, weight, or if they have any specific requirement. So they do the matching, and they try, of course, their hardest to do the best match. And then they forward the profiles to me. So there are no pictures, no descriptions. They're just a profile. So their height, weight, again, eye color, hair color, basic information, and hobbies, education. And that is forwarded to the patient. And also, even during the treatment, the patient's not allowed to see their treatment plan or any medical history. Of course, if there's for the future, if the patients do get pregnant and there's some medical issue or they need more information from the donor's profile, then it can be provided when it's needed at that very moment. That is possible. Overall,
sorry, but it's good that you can give to the couples some profiles, blind profiles without names and without identity, but at least with some information about the donor, and they can choose, right, between these profiles?
Yes. So we have 3 different packages where they can choose from, well, they are either given 1 profile or they can choose from 3 or 5 profiles. So
and
they
what is your experience about the patients? Are they asking for that, to be able to choose from profiles?
Mostly, yes. Mostly they wish to be kind of part of the process, so they wish to choose from 3 to 5 profiles. Yes, most of my patients do want that.
That's nice. That is one of the limitations that we have in Spain, because the legislation is quite similar to yours. It's completely anonymous. But our legislation, it says that the patients of the couple cannot interfere in any of the procedures during the matching of the donor. So the whole responsible person that is doing that is a medical doctor, the medical team. And we cannot offer to the patients these 3 profiles to be able to choose. And I'm aware that a lot of patients are asking for that. So it's a good thing that you in Czech Republic can do it. And as I am aware as well, you have guarantee program, right, in terms of blastocysts in the egg donation program. Can you explain it a little bit more? Which package you have?
For the patient. So we have a standard one, then exclusive and exclusive plus, and that is also when it comes to the donor profiles as well as the embryos that are guaranteed, as long as, of course, there's a normal sperm of the partner, then we can guarantee 2, or the exclusive plus is 5 embryos. The embryos are at the blastocyst stage, so it's the 5th day of the cultivation. And again, we highly recommend a single embryo transfer, or if the patients choose 2 embryos for transfer, and then the remaining ones get frozen on the same day as the transfer.
But it's a very nice program for patients that travel from abroad, because they know, normally the main concern is that I don't know how this clinic will work, because most of them is the first time that they come to the clinic. So if you can give them guarantees of blastocysts, at least this is a good way for them to be sure that the travel and the journey will be worthy, and they can have 1 embryo for a fresh transfer, and then some other embryos for a frozen foreign transfer, right? So
Yes.
I think it's a good program. We as well have this program guarantee. We have different programs. The basic one that is we don't guarantee blastocysts, but then we have one program that we guarantee 1 blastocyst, 2 blastocysts, or 3 blastocysts, depending of that. But I think it's a good way for the patients to give them confidence enough that they can travel with this guarantee. So it's nice to have it. In terms of the egg donation program as well, which kind of genetic tests are you performing to the donor? Because now actually is very well known that the genetics, we all of us carry some mutations, and patients are asking more and more about the genetics of the donor. So what are you doing at Clinica?
So when it comes to the donors, they of course have to do all of the gynecological checkups. They have to go to a geneticist as well, to psychologists. They of course do the STD test, the sexually transmitted diseases. They also do a karyotype, which is a blood test for the shape and the amount of chromosomes. And for the donors, when it comes to genetic testing, if they're from the Czech Republic, if they have the insurance here, then they're tested for the most frequent diseases that are here. But if, let's say, we have a donor from a different country, then we would do the genetic testing according to the most frequent things that are done in their country, if that makes sense. So in the Czech Republic here, it would be definitely the karyotype, then the cystic fibrosis, there's muscular dystrophy, the spinal atrophy, and all of those that are the most frequent. So that's what they have to go through. And of course there's a psychologist, so to do the genetic and kind of mental disorders even in their families, stuff like that. So yeah, so that would be for the genetic testing of the donors.
Great. So in Spain, we don't have a list of genetic diseases that we have to perform mandatorily. But the law says that we have to test all the genetic disease based on the scientific knowledge. So this gives a wide open window of which number of genetic diseases we can test. But as you say, we do the same. We test for the most prevalent and relevant recessive genetic diseases. We do a test that tests more than 300 genetic diseases and give the possibility to the partners to do the genetic matching. So if we can know the mutations of the donor and we can do the test on the male partner, we will be able to assign a donor that don't share the same mutation. So we are minimizing the risk of having a child with some genetic conditions. And this is one thing that more and more patients are asking every time, because they want, at the end, they want a healthy baby, right? So great, I think we have covered a lot of things, but I don't know if there is any topic that you want to point out here.
I think that will be all. Of course, if the patients have any specific questions or they need an additional, information, they can always contact us and the coordinators, including myself. We can give them, the answers for everything if we haven't covered it.
Okay, at the end of the talk, I can put the email address at Unica and Reproclinic. So if anyone can have any potential patient that can have some questions, they can ask, and we will be very glad to have them. So just to conclude, I think we can work coordinately in the same way. So we have the same legislation, more or less the same framework of legislation, but some slightly different things that we can help each other in terms of being able to treat all the patients with all the concerns that they may have, with the kind of families they are creating, with the embryos that they have stored on the clinic, with the egg donation program. So there are a lot of things that we can achieve together. As I said at the beginning, Unica and Reproclinic, they work in the same way in terms of holistic fertility approach. So both of us, we have our partners that can work with acupuncture, reflexology, nutrition, and coaching during the treatment and after on the pregnancy. And we will have the patient from the beginning to the end. We have the professionals working inside the country and outside, so we can coordinate the treatments in the country origin of the patient. And we both work in the way that we try to minimize the travel expenses for the patients to get the transfer. So we try to coordinate as maximum as possible the treatment in their country, so they only have to travel to the clinic the 1 or 2 times maximum. So Klara, thank you so much for your time, because I know that you are very, very busy. And I will put the email addresses, so any questions may arise, please feel free to contact us. Thank you so much.
Thank you. Bye.
Thank you. Bye.